Hi everyone, welcome to my YouTube channel. My name is Zeti at Nashville, and I do videos to do with healthcare. Now, we'll jump straight into the video, and today I want us to discuss these terms that are flying around, and this COVID has brought us to be very close to healthcare terminologies. And there's this place where people say, what is the difference? Yeah, someone is admitted in the ward, Mara, another one is saying HDU, is going to ICU. Okay, so what is the difference? Is it not the same hospital? Is it like they're treating different things? No, these are just different levels of management, and it depends with how the patient is. Okay, you can go into the hospital in a general ward and you deteriorate or your condition gets worse and you're taken to ICU. Okay, so ICU in full is intensive care unit. Intensive care unit is where we have people who've been trained, yeah, the physician, the nurses, the respiratory therapists, all the neurologists, all I say they have been in intensive care management. They are able to take care of you. Okay, so in this pandemic period, you can be admitted in a general ward with some little chest pain from COVID infection, of course, from COVID infection, and then you develop complications. Even if when you're in medication, you don't respond well, or the virus just takes you up faster than the other person, and then now your condition changes and becomes worse while you're in the general ward receiving the normal medication for whatever reason you went with. And then when the condition changes, then they see that you cannot be able to manage and you need life support. Actually, the ICU is where you go to get the life support. If your body cannot function by itself, if your organs are not functioning by themselves well in a way that they're supposed to function, especially now your respiratory system, your lung system is not functioning well, you're not able to breathe by yourself, and you're not taking in enough oxygen to be able to supply nutrients in your brain and the rest of the body because of the effect of the COVID on your lungs. So you'll be taken into the ICU, to the ventilator, to help you breathe well and also to take in the oxygen that will be supplemented to you. Okay, so now what is the difference between ICU and HDU? Actually, you can have the same ward, and then one section is an HDU and the other one is an ICU. Okay, so ICU is the nurse to patient ratio. So in ICU, one nurse attends to only one patient. Okay, HDU, you can find that one nurse attends to one or two patients. So like here you have, the nurse has to sit there. In ICU, the nurse is there like the whole shift. If the shift is for 8 hours, he's there with the patient for 8 hours. You're monitoring the monitors because by that time you're attached to monitors to monitor how your heart is functioning, to monitor how you're taking in oxygen, to monitor how your brain is functioning, to monitor even how your kidneys are functioning. So you're basically attached to many equipments that are monitoring how you're functioning, and also checking recording, and making sure that it doesn't miss any anomalies that is coming up. And if you have any anomalies, he or she jumps into action, calls the relevant therapists to come and work on you. And then when you show some signs of improvement or stability in your functioning, then you might be sent to the HDU. You might just be wheeled down to the other side of the ward, or you might remain in the same spot. If you're like two of you, now you'll be allocated one nurse to take care of you. Now this will be a HDU section, but you might still be in the same on some or the same equipment, but your condition is stable. Okay, and people stay in ICU. People might stay in HDU longer than in the ICU. Okay, because in ICU critical level, yeah. And then in HDU, that is when you're showing improvement, so you can even be discharged either straight from HDU, but you can be discharged straight from HDU to the general ward, where you will continue getting the normal care for 1 or 2 days, and then you can be discharged home to the community. Okay, so I hope we have understood. General ward is general medical ward, where you have like here in Kenya you'll have like 1 nurse to 5 or 10 patients. So depending on the facility, depending on the hospital, even the HDU sectioning depends on the facility. Yeah, if it's the upscale facility, you'll find that ICU has each patient has their own room, and they have their own office where the nurse stays. And it also depends with which condition you have. If you have an infectious condition like now COVID, you'll find that there is a screen between you and the nurse, so that when they are doing their checks and their notes, they can be able to lessen on their PPEs. But if the room doesn't have that provision, then you will stick there with your nurse for the whole long period. Okay, so it depends with what type of hospital you are in and how well they have organized their things, but that is basically how we differentiate the ICU, HDU, and the general ward. Okay, thank you very much for listening in and watching my video, and please let us recommend so that people can subscribe. We grow our viewership, and then we grow together so that you can get information out here to many people who need it. All right, this is Zeti, and it's bye for now. Love you all. Trained in intensive care.